Thank you very much. So I will talk from the side of the EACS about the needs and criteria and quality assurance of CCCs. But let me start out by giving my optimistic and simplified view of the Europe Beating Cancer plan and a mission on cancer, where one is really focused on bringing better care to patients, and whereas the mission on cancer is focused on understanding cancer. And comprehensive cancer centers play a critical role in that, and you heard already of these collaborative networks and how they might be organized or are already organized. And they require supportive platforms, EU-wide registries, biobanks, and data repositories. What they also need, but which is not so emphasized in the system, is careful outcome research in order to show that what they are trying to do, that indeed makes a difference. And I think that's something that is sort of missing in the whole system already, because we might be surprised how poor some of the new treatments perform in comparison with treatments of 10 or 15 years ago. So these specific cancer research infrastructures, you heard already quite a bit about it, but in order to make them in innovative centers, it's really required that they have a number of particular activities, and they don't need to have them all at the top level, but basic and translational research, clinical trial capacities, and also this outcome research, which I think is very important, and obviously the platforms with the omics and records, and we heard a lot about that. If I look at how this system should work, then as we heard from the local comprehensive cancer networks, that involves the outreach community hospitals, and I think they are actually the real treatments entities that reach most of the patients. In addition, these comprehensive cancer centers should also interact with each other, and we will hear tomorrow more examples of that of Cancer Core Europe, where we see this type of collaboration between different countries. And I think in the Netherlands, we have been building these systems actually quite well. If I look at a very complicated environment like Amsterdam, where we had 2 university hospitals, as well as the Netherlands Cancer Institutes, that each of them have, of course, their own ambition. Nevertheless, we have managed to collaborate together, include local hospitals, and sort of agreed on where patients would be best treated. And in that way, we provide maximum service to the community. And Simon alluded to that, and that's also true for other areas in the Netherlands. What it tells me, and that's important, in order for networks to work, they shouldn't be too large. You can talk with so many people. If you have to make arrangements with hundreds, you're not going to accomplish anything. So you have to keep them local. You might still interact with others, obviously, for specific areas. And again, Cancer Core Europe might be a good example of that. But again, I would say, keep it simple. What is important, though, that within those entities, there is commitment to high quality. And we have heard already a number of efforts to do that, and actually the only effort that has worked is OECI accreditation, and all the others are promises. And I think that is already quite a standard next to what we see in the German system, that there is a clear evaluation with respect to quality and interaction. And so it's not only hospitals, it's also the participation with other stakeholders, both pharma, hospitals, and patient organizations, and societies of experts patients and charities, and I think very essential for education and training. What seems to be a good formula, especially if we want to establish CCCs in undermet areas, is to adapt this idea of twinning, where one institute which is quite advanced sort of meets with an institute in this less privileged area and try to team up. And that can be done both at the institutional level, but also at the individual level, and that way build capacity. And finally, since real breakthroughs come simply from creative investigators, create programs that support innovative PI-initiated projects, and especially like the ERC in Europe is a beautiful example of that. And I wish that many of the programs are just thrown away and replaced by a wider support like ERC, which would actually boost quite a bit in Europe. It's just a wish which unlikely will be fulfilled, I'm afraid. So the role of CCCs in the cancer research continuum, they are not all the same. You can assume that not every CCC has a very strong basic research activity or a very strong clinical activity. So they come in flavors. And so many years ago, the EACS established the designation program for Comprehensive Cancer Center of Excellence that would sort of cover excellence CCCs that are excellent in many aspects of this continuum. I have to say that thinking about that, you have to realize that if you would go through Europe, and even if you encourage these excellent CCCs, you would only find a handful, and that would insufficiently stimulate the whole system. And that's why I think comprehensive cancer centers in general should aspire to excel in at least some areas of cancer research and still cover the rest at a level that will give first-rate care. The advantage of that is very clear, because if you have within a CCC a couple of groups that do excellent work, that is actually inspiring for the rest, and it will elevate the whole environment. And so I would be greatly in favor of really identifying a number of excellence modules, so to say, that one could stimulate in any CCC in order to enhance the critical mass and improve the quality. And here I list some of these areas that you might think of. And such modules of excellence, I mean, they might be specific for innovative basic research, diagnostics, prevention, but also surgery. I mean, we have to realize that surgeons and radiotherapy are still a very effective treatment of many patients. And so there should be a more appreciation for these areas, and actually we should encourage the quality in those areas as much as doing that for new drug combinations. So how to build these infrastructures, and we already saw the OECI accreditation, which I think is and the EACS designation of excellence. I think we have to provide specific assistance to centers for centers in areas of unmet need, encourage other participation of other stakeholders, include societies, patients, and charities. I mentioned already the twinning, and the close engagement with local hospitals. And the EU mission on cancer is a start to facilitate this process. But the problem of all the EU initiatives so far is that they last for a number of years and then they disappear. And if we want to build centers in Europe, that's not going to happen in 3-4 years. And so it's sort of an initiative of which you know it's going to fail unless you find a solution to have sustained long-term funding. And so the issue is that it's not necessarily even an enormous amount of money that is needed for it, but it is absolutely a requirement. And I remember in the initial day of the network in Europe that they had, Cancer Core Europe, how difficult it was to get a little bit support for this communication. And here you see an example where it's actually peanuts in order to stimulate it, and where for some reason it's impossible to receive the support for that. So we simply need to join forces to establish this, and we have to agree on the clear criteria, complement the concept of CCCs of excellence with maybe modules of excellence to make a system more flexible, provide incentives to develop those modules, and establish clear protocols for this excellence designation modules. And well, the EU Net CCC is in an excellent position to catalyze this, but I would say please don't complicate it and take advantage of what we already have, because that's already quite complicated. And so we should rather try to simplify rather than further complicate. And just as one last example, which is in my view at least a successful CCC network, Cancer Core Europe, and I think Joseph Tabanero will talk about that tomorrow more, but here we see that a number of centers within Europe collaborate. And those are centers of high quality that can run very sophisticated trials that you would probably not do in your own center, and which align with respect to diagnostics and other interactions with the outside world. And so with that, I would like to stop and hope that we feel collectively that we should try to establish a simple, accessible system that will benefit patients and where clinicians and researchers enjoy working. Thank you very much.